President-elect Joe Biden says the Trump administration is falling far behind on vaccinations. He's promising to ramp up shots when he takes office. Operation Warp Speed set a goal of 20 million vaccinations by the end of the year. So far, only about 2 million have been given, according to CDC data.
As I long feared and warned, the effort to distribute and administer the vaccine is not progressing as it should. I've directed my team to prepare a much more aggressive effort with more federal involvement and leadership to get things back on track.
President-elect Biden says he'll push Congress for more funding and he'll use the Defense Production Act to boost the pace of vaccinations. NBC's Jeff Bennett in Wilmington, Delaware. And Jeff, Biden is sticking with his goal of 100 million vaccinations in his first 100 days.
That's right, Contessa. Good evening. The president-elect's remarks this earlier today actually served three purposes. One, it was a warning. He warned of a spike in coronavirus caseload and the death count and said that the pandemic will get worse before it gets better. He also used his remarks to call out the Trump administration for its slow pace in coronavirus vaccinations. The Trump administration has only vaccinated about 2 million people, even though they promised to vaccinate 20 million Americans by year's end. And Biden also articulated a plan for how to kick this vaccination process into high gear once he's sworn in. He called for more funding for Congress. He also said he would use the Defense Production Act to increase the production of vaccines and also the protective gear needed to administer it. All of it is part of his plan to get those 100 million vaccinations into arms in the first 100 days of his presidency, Contessa.
Jeff, thank you. Covid-19, of course, has crippled hospitals and health systems across the country. Few were hit harder than Holy Name Medical Center in Teaneck, New Jersey. The vaccine brought welcome news there, the hospital doling out hundreds of doses since the vaccine's approval. Michael Marin is the president and chief executive officer at Holy Name Medical Center. Great to see you today, Michael. I know your hospital at one point was the epicenter of the virus. How are you guys doing now?
We're doing okay now. So all the preparedness that we had back in March and April is paying off dividends now as we've seen this second surge in the fall. And so that helped tremendously. So we were much better prepared.
Is there a lag right now between the vaccines that you have on hand and getting them into the arms of the people who need the most, who are in line to get them?
No, not at all. As the vaccine comes in, we're administering it. We have the capacity to do more than we're currently doing. We're taking this in a very methodical approach. This vaccine is precious. We don't want to waste any. And we have to remind everybody it's a 2-dose vaccine. So it requires 2 shots, one 21 days later if it's the Pfizer drug, 28 days later if it's Moderna.
What does that mean that you have more than you're able to administer?
No, we have more, as the drug comes in, we can administer it. What we don't have right now is a regular schedule of supply of the drug. So if I know, we don't want to schedule people and then have to cancel them because the drug's not available.
Right.
So we're scheduling as we know we have drug available to administer so that we're keeping everybody on pace.
Have you been given guidance about how you go about moving from the hospital community to the community at large?
Well, we kind of figured that one out on our own. So we're working with Teaneck, who's been a great partner in all this. We're going to go into one of the large community centers that has 2 gymnasiums side by side. We're going to set up a registration area where we're actually going to encourage people to do it online ahead of time. That's the most efficient and ideal approach. Come in. If you're green lighted, you go right in. If you're vaccine ready, short sleeve shirt, easy to get the needle in the upper arm. And then we send you into an observation area for 15 minutes, and then you're on your way. And so under that model, we expect to be able to do, at a minimum, 1,500 a day.
Wow. Michael, that's the most detail I've gotten. Thank you for that.
Shepard Smith here. Thanks for watching CNBC on YouTube.